Now let's dive even deeper into facelifts. There are a whole bunch of different types of facelifts. I'm sure you've heard about the thread lift, ponytail lift, mini lift, full facelift, 3/4 lift, 7/8 facelift. There is a million different types of facelifts. In order for us to be on a common language, I have to basically state that a lot of the terms that are used to describe facelifts are essentially marketing terms, similar to a ponytail lift. It doesn't tell me anything scientific about what is happening. Therefore, I prefer to use scientific terms for the most part in terms of describing how or what type of lift is necessary for a patient. Before we jump down that section too deeply, let's talk a little bit about facelifts and relevant facial anatomy. So if you remember from our anatomy video, we have skin and then we have that muscle layer underneath. So one type of facelift could be a skin-only facelift. In that type of facelift, what would essentially happen is you make an incision, you dissect under the skin, pull the skin back, cut the excess skin, and sew it up. This type of lift is called a skin-only facelift. This type of facelift is quick, it's easy, very low risk. The problem with this type of facelift is that it doesn't really have long-term viability. It doesn't last a long time. And there's a very specific reason why. The skin itself has no integral strength. And what I mean by that, I'm going to give you an example and it'll make a lot more sense. So imagine I had a 3-inch long rubber band. And I take the rubber band and I keep pulling it back and forth. This is kind of, that pulling back and forth is representative of what the facial muscles are doing. Now, at the end of the day, that 3-inch long rubber band may probably end up being 4 inches long. If you cut off an inch off the end of the rubber band, you will still have a 3-inch long rubber band. However, if you continue moving it back and forth like this the next day, you're going to lengthen it once again. So this is exactly what happens in a skin-only facelift. You lift the skin, you pull it back, tighten it, sew it up. It looks great for a temporary period of time. However, you haven't released any of the ligaments that I had described in the facial anatomy talk, and all of the muscles are still going to be pulling against that skin closure. So you're going to get a high tension skin closure, which is going to give you a bad scar, but also you're going to go back to exactly where you were before because you haven't really released all those ligaments. So any facelift that's going to be durable needs to release some of the ligaments, depending on where the aging is, and needs to address the muscle layer underneath. So now we have a very scientific basis of talking about types of facelifts. So all the facelifts that are offered here in my practice, A, address the muscle layer. B, involve dividing some, if not all, of those facial retaining ligaments based on the anatomy of the patient. What this allows me is A, long-term longevity of the facelift. 2, taking tension off the skin closure. 3, all the tensions on that tough muscle layer. 4, a very natural look without looking pulled or overdone. So this is the reason why we do all muscle-related lifts. Now I will further explain the 2 different types of facelifts that I do in my practice in the next video.